Good morning and good afternoon to everyone joining us today. My name is Mitali Mistry, and I am a senior project and policy coordinator here at the International Federation on Aging, or IFA. And I will be moderating today's interactive dialogue named Raising Awareness of RSV as part of your vaccine preventable respiratory diseases in Canada. So, this interactive dialogue aims to bring awareness and improve understanding of respiratory syncytial virus, or RSV, as a serious life-threatening vaccine preventable disease across organizations that represent high-risk adult populations, ultimately supporting awareness of vaccination as a key prevention strategy for RSV. Before we begin, I want to quickly address some housekeeping. We would like to remind you to please keep your microphones muted during the session. For the moderated discussion portion of the session, you may pose questions and comments in the chat box, and we may give the opportunity to pose your question. So also feel free to keep your videos on during the session if you'd like. And the session will also be recorded for note-taking purposes and will be posted on the IFA's Vaccines for Life platform. All right, and then I'm just going to go over our today's agenda briefly. So for today's session, we'll be starting with a presentation from my colleague Salsabila Ahmed on setting the scene on respiratory syncytial virus, RSV, amongst older adults and at-risk populations in Canada. And then we're going to move on to our panelists with introductions and some statements. We will then have a moderated panel discussion that will provide insight on the knowledge of RSV awareness, followed by some key takeaways to support actionable recommendations for the way forward. And then we'll conclude the interactive dialogue with some closing remarks. So with that, I will now hand things off to my colleague Salsabila Ahmed.
Welcome, ladies and gentlemen, to our interactive dialogue on raising awareness of your vaccine preventable respiratory diseases in Canada, hosted by the International Federation on Aging. My name is Salsabila Ahmed, and I'm one of the policy and project coordinators here at the IFA. The International Federation on Aging is a non-governmental organization that started in 1973 at a time when the impact of an aging population was just beginning to be understood by some governments. Since then, the IFA has worked tirelessly to advocate for the rights of older people, promoting their inclusion in UN Sustainable Development Goals and protecting their rights worldwide. At the IFA, we strive for a world of healthy older people whose rights are safe and appropriate vaccines are protected and respected through programs that hold high the principles of prevention, access, and equity. Over the last 45 years, the IFA has become known as a leading and innovative organization that works across disciplines and sectors towards the common goals that improve the lives of older people. IFA's mission is to drive the agenda of the world's aging population so every older person can live the life that they deserve to the fullest in their society, and that respects their past, present, and future contributions. Our goal is to be a global point of connection of networks and expertise to influence and shape policy, age-related policies. Improving the rates of vaccination globally is a priority here at the IFA as a key contributor to healthy aging. The IFA, across almost a decade and through its Vaccines for Life program, has worked tirelessly alongside committed organizations to address barriers and improve adult vaccine rates in the context of healthy aging. Vaccines for Life is framed by three intentions. Number one is to be a reliable source of information, evidence, and good practice across sectors and disciplines on the link between adult vaccination and healthy aging. Number two is to mobilize knowledge of experts and expertise through the creation and use of innovative platforms and channels of communication. And finally, number three is to influence and help shape policy related to adult vaccination and at-risk groups through capacity building at the national and international level. At the IFA, we prioritize immunization for all ages, and our work includes prioritizing immunization as a key pillar of expanded prevention strategies, removing barriers to access and ensuring that all people are protected and no one is left behind, and establishing equity through timely and affordable access throughout life. The IFA is committed to partnering with others and by participating in the Healthy Aging Collaborative as part of the United Nations Decade of Healthy Aging, which is a global collaboration aligned with the last 10 years of the Sustainable Development Goals that brings together governments, civil society, international agencies, professionals, academia, the media, and the private sector to improve the lives of older people, their families, and the communities in which they live. By acting together, we can add quality to quantity and give all people the chance to lead meaningful life no matter what their age might be. Longer lives are one of humanity's greatest achievements. However, we don't just want to add years to our lives, we also want to enjoy good health and well-being in later life. IFA's work in vaccination is guided by key global agendas, all of which respond to the WHO's 13th General Program of Work with the goal of ensuring healthy lives and promoting well-being for all ages. The UN Decade of Healthy Aging calls for a whole society approach to improve the lives of older people and for no one to be left behind. The Immunization Agenda 2030 positions a life course approach to immunization as a contributor to physical and mental health and as an investment to creating a healthier, more prosperous world for all. Improving vaccine rates throughout life, but particularly for older people and high-risk adults, contributes to achieving sustainable development goals. This is healthy aging. Today, too many people around the world experience worse health than they should because of unsupportive environments that prevent them from maximizing their later years. Last week, the IFA took part in the Global RSV Awareness Week. As health systems and healthcare professionals work to restore normal services in the wake of the COVID-19 pandemic, the threat of an RSV outbreak, coupled with other vaccine preventable respiratory diseases, poses a significant risk this winter. This is coupled by a general lack of awareness about the severity and complications of these diseases, as well as insufficient advocacy from non-governmental organizations and civil society organizations that represent older adults. The Raising Awareness of Your Vaccine Preventable Respiratory Diseases in Canada is funded by Pfizer Canada, and this project aims to increase awareness of RSV as a serious vaccine preventable disease amongst organizations representing high-risk adults in Canada and highlighting vaccination as a crucial prevention strategy. Respiratory syncytial virus, commonly known as RSV, is a contagious virus that primarily affects the respiratory tract system. RSV enters the body through the eyes, nose, or mouth, and it can easily spread through the air in infected respiratory droplets. Symptoms of the virus can include stuffy and runny nose, mild to moderate headaches, or mild coughing. However, in more severe cases, there can be difficulty or rapid breathing, severe coughing, or wheezing. If left untreated, RSV can pose and lead to serious complications such as pneumonia and bronchitis. RSV tends to pose a high risk of complication and hospitalization for infants, older adults, and those who are immunosuppressed. People who are infected with RSV can get repeat infections, and individuals of any age can be reinfected. However, reinfections pose a greater and more serious health concern in older adults. RSV currently results in 3.4 million hospitalizations and around 100,000 deaths worldwide. This statistic is only projected to rise in the forthcoming years, highlighting the urgent need for enhanced prevention policies. The number of Canadians aged 65 and older is expected to exponentially increase over the next 2 decades, with projections showing a surge of 68% in this population group. With the rapidly aging population, the need for proper healthcare measures and prevention strategies is of utmost importance. Based on the National Seasonal Influenza Vaccination 2023 to 2024 coverage survey conducted by the Government of Canada, it was found that 40% of adults have not yet heard about RSV, while 33% have heard about it but are not aware of what the symptoms might be. Health Canada has recently approved a vaccine for prevention of RSV in adults aged 60 and older, but upticks in this population are still very low. From that same survey, it was noted that overall, only 1/3 or 30% of adults would definitely receive the RSV vaccine. Seniors and younger adults are most likely to receive the vaccine compared to those with chronic medical conditions. The most common reason noted for not receiving an RSV vaccine is the belief in immune system capacity, followed by concern about the safety and its side effects. On July 12, 2024, the National Advisory Committee on Immunization, commonly referred to as NACI, issued a statement regarding RSV vaccine and prevention strategies. This statement emphasized the importance of RSV immunization programs for adults aged 75 and older, particularly those at heightened risk of severe RSV disease. Additionally, recommendations were extended to individuals aged 60 and over residing in nursing homes and other long-term care facilities. NACI also provided a discretionary recommendation for healthcare providers to consider RSV vaccine for adults aged 60 to 74 based on individual consultations. The current level of awareness and intent to receive the newly approved RSV vaccine is lower than that for influenza and COVID-19. This highlights the need for enhanced public education and promotional efforts to improve understanding of uptake in RSV vaccine. As part of this project, the IFA launched a national survey aimed at NGOs, CSOs, and professional organizations that represent older and at-risk adult populations. The survey aims to address the critical gaps in RSV awareness and prevention and gain insights from representatives working with older adults and at-risk populations on improving the understanding of RSV and advocating for vaccination as a key preventive measure. The survey is currently ongoing, and the link has been attached in the chat for anyone who wants to complete it afterwards. The key aims of this project, as noted before, is to underline key knowledge gaps in RSV awareness at the organizational level amongst at-risk populations and understand the challenges in promoting RSV awareness with the end goal of supporting organizations in their efforts to educate and improve awareness of RSV amongst older and at-risk adults and advocate for RSV vaccinations. Along with the national survey, we conducted focus interviews with key stakeholders from organizations that help vulnerable populations across Canada. Some key findings that were noted include the following. Healthcare providers are essential. Some key findings that were noted include the following. Healthcare providers are essential for promoting RSV vaccine initiatives, but they need more educational tools to effectively advocate for these vaccines. More understanding and awareness about RSV, its impacts, and the importance of vaccination is needed. And finally, more funding is needed by organizations to promote RSV vaccine in older adults and at-risk populations. The insights obtained from these interviews and this interactive dialogue will inform the creation of a consensus statement, which will outline key recommendations from NGOs, CSOs, and professional organizations across Canada. Additionally, an infographic and fact sheet will be developed as a versatile resource to assist organizations in effectively communicating with their communities about RSV and enhancing awareness amongst older adults and those at risk. The objectives of this interactive dialogue ultimately hope to increase awareness and understanding of RSV, promote vaccination, and influence policy and practice across Canada. Our first objective is to increase awareness and understanding of RSV and enhance public and professional awareness as a significant life-threatening vaccine-preventable respiratory disease, especially amongst older adults and those with chronic conditions. Secondly, we hope to promote vaccination and advocate for the importance and accessibility of RSV vaccine for older and at-risk adults across Canada, with the aim to reduce morbidity, mortality, and healthcare cost burdens associated with RSV infections. Finally, we hope to gather insights and consensus from leading NGOs, CSOs, and patient and professional organizations to influence policy development and healthcare practices on RSV prevention. Now we will go to the second part, so I'll give it back to you, Mitali.
Thank you so much, Salsabila, for really setting the scene on RSV and its impact on older adults across Canada by presenting IFA's work and findings for this project. To continue this dialogue, we now want to focus on knowledge from NGOs, CSOs, and patient and professional organizations. So we have two panelists joining us today, Dr. Rita Adami, Chief Pharmacy Officer at the Canadian Society of Hospital Pharmacists, and Mr. Arushan Arulnambi, Policy Analyst from the National Institute on Aging. I will now be asking both panelists to introduce themselves and to provide a statement for the following question, which follows as, given the susceptibility of older adults and at-risk populations to RSV, how can government, CSOs, healthcare providers, and communities collaborate to implement more targeted prevention strategies? So we'll start with you, Mr. Arulnami, if you don't mind, and then we'll move on to Dr. Dami afterwards.
Thank you, Mitali. Hi, everyone. My name is Arushan. I'm a policy analysis for the National Institute on Aging, also known as NIA. Over the past few years, I've led the development of NIA's policy initiatives surrounding vaccine-preventable diseases among older Canadians, including being the lead author for their recently released RSV white paper. I look forward to bringing the various data and information I've come across into our discussion today surrounding RSV awareness and vaccination. So, as earlier noted, RSV infection is actually commonly associated with the young children, as almost all children have experienced their first RSV infection by the age of 2, and this age group has the highest hospitalization rates. However, as you see in the slide here, older adults actually has the highest mortality rate attributed to RSV infections, more than 6 times larger than the mortality rate among children younger than the 1 year of age. And just to note some other groups that are susceptible to significant complications from RSV infections include individuals with certain high-risk conditions, such as cardiac and respiratory diseases, and immunocompromised individuals. Among this group, not only does RSV infection actually worsen current conditions, but also increase the risk for serious outcomes. With that being said, a lot has been done in the RSV landscape in Canada. So, in the past 2 years, for the first time, there's been two RSV vaccines approved, RSV and Abrysvo. Both vaccines have been approved for older adults, with Abrysvo also approved as a maternal vaccine. So, and recently, as noted, the National Advisory Committee on Immunization, NACI, released their vaccine recommendations this summer. Despite the approvals, despite these new recommendations, we see that with long-standing vaccines, that more work needs to be done to increase uptake. As you can see here, some vaccines have not reached the targets set by Canada or have received a low uptake amongst the population. So what can be done? Firstly, at the government level, there needs to be improved surveillance of RSV. There currently exist 3 national surveillance systems, but they have limitations, such as not offering an accurate estimation of the burden of illness among certain populations, such as older adults. And we noticed that the way they monitor cases actually may omit many cases that occur among young children and older adults, which the NIA recommends moving forward to use a more expanded definition to increase detection. Secondly, there needs to be improved funding of RSV vaccines. In a recent survey by the NIA, we actually found that even though a lot of older adults are aware of the RSV vaccine, only a small percentage actually receive the vaccine itself. One of the factors was actually last year, when it was first approved, only one jurisdiction publicly funded the vaccine for certain high-risk older adults. And we consider this as an important factor as the most commonly reported obstacle for adults in Canada regarding routine vaccines was actually the cost of vaccine itself. So with the new NACI recommendations, there has been improvements. As of September 2024, there are now 3 jurisdictions that actually fund the RSV vaccines this year. However, there is more work to be done. Other things that the government can do is harmonizing the administration of vaccines. Despite most jurisdictions in Canada allowing pharmacists to administer vaccines, this cannot be said for publicly funded vaccines such as pneumococcal and shingles vaccine. So a focus on allowing pharmacists to administer vaccines should be given, as not only they are more accessible, conveniently located, but we have seen that the use of these healthcare providers have always relied to an increase in vaccine coverage. And lastly, the governments need to focus on how to monitor RSV vaccines. Currently in Canada, there are numerous national vaccine coverage surveys. However, there are limitations such as response rates and even inconsistency across surveys themselves. And secondly, an avenue is immunization information systems. However, currently in Canada, there is a patchwork of these systems with every province and territory following a different system and process. So another stakeholder I wanted to note in this presentation is healthcare providers. This is a very important group because we constantly see the influence of providers on uptake of vaccines. For example, the recent PHAC survey found that actually healthcare providers were the most commonly reported trusted source of information about vaccines. Additionally, it's been found that among those who have not received vaccines, most are actually generally likely to receive vaccines through the recommendation of a healthcare provider. And it's important to note that the impact of vaccine concerns must be considered as safety, effectiveness, and not having enough research were commonly seen as the main reasons for vaccine hesitancy across various vaccines. And also, it's been found that the public are not fully aware of what's recommended to them. So we'll need to use the healthcare providers to ensure this information is brought forward to the public. And we need to consider healthcare providers because in the research, we found that providers' knowledge of RSV, there are clear gaps that we need to look to target, such as epidemiology of RSV infections and even the burden of RSV infections. That's the points I would like to note today and look forward to the discussion. Mitali, I'll pass it over to you.
Thank you so much for your statement on that. And then we'll have Dr. Dami go ahead.
Thank you. Well, good morning, everyone. I'm pleased to represent sort of that perspective from healthcare professionals on this critical issue of RSV and the profound impact it has on older adults and other at-risk populations. My current role, I'm the Chief Pharmacy Officer at the Canadian Society of Hospital Pharmacists, and our organization represents pharmacy professionals, both pharmacists and pharmacy assistants and technicians that are working more so in the collaborative care environment. So hospitals, ambulatory primary care clinics, long-term care facilities. And as an organization, we really do try to support our members through advocacy, through education, information sharing, and promoting best practices. And as a pharmacist myself, this topic hits close to home since my practice area has been in not just hospital, but I've spent most of my career working in infectious diseases. And so we know that RSV is mostly originally associated with infants and young children. That's usually the first exposure that people have to the virus. But its effects on older adults, particularly those over 65, have just been highlighted. Individuals with compromised immune systems, the impact can't be underestimated. And in these populations, RSV is not just the common cold. It leads to very severe respiratory complications, long-standing bronchitis, pneumonia, prolonged hospitalizations. And as we age, our immune systems are just more vulnerable. Again, it naturally weakens with age, making it harder for the body to fight off infections like RSV. And then compounding this, again, many older adults live with chronic conditions like heart disease, like diabetes, like COPD, and that further increases the susceptibility to all of those severe outcomes. We know that over time, again, adults over the age of 65 account for a significant portion of RSV-related hospitalizations every year. And moreover, RSV is especially dangerous for those that are residing in nursing homes or long-term care facilities, because again, those close quarters can accelerate viral transmission and again, ping pong the infection back and forth between those residents, leading to outbreaks and leading to more, challenges in treating that group. The thing that I do want to highlight is that we've had some recent advancement in RSV vaccines targeted specifically, again, at that older adult population and those at risk. We're finally at a point where we can offer some direct protection to these vulnerable groups. However, the awareness and uptake of the vaccines has to be improved to truly impact public health outcomes. Again, myself as a pharmacist, we do play a pivotal role in all of this, but I think all healthcare professionals do in terms of educating patients and caregivers on the value of vaccines, ensuring that vaccines are readily available in their healthcare facility. And as we get into this discussion, we'll talk a little bit more about the options and the preventative strategies, simple actions like, hand hygiene and, washing your hands, wearing masks during RSV season, early screening in those high-risk populations. Yes, absolutely, that can significantly help reduce the spread of the virus, but it's not enough. Combating RSV, especially in older adults and high-risk individuals, really requires a multifaceted approach. Both health systems, public health authorities, healthcare professionals have to work together to ensure that the high-risk populations are identified early, vaccinated early, and educated about the risks. We must also work to address some of the health disparities by reaching out to some of those more underserved populations. Again, certain patient demographics, rural regions. Again, those areas typically don't have as easy access to preventative care vaccinations. And it's only by doing that that we can reduce the growing threat of RSV. Again, I'll just highlight in terms of sort of key considerations and opportunities, healthcare professional knowledge aligned with a public awareness campaign would be a key target initiative. Harmonization of access of the vaccines. Again, it doesn't make sense that in a country like Canada, each province has different coverage for vaccinations. Really, we want to work on aligning those and ensuring that there's equitable access between the different provinces. And the last piece of it is, again, the bigger picture, public health doing their piece around monitoring and surveillance of RSV infections.
Thank you so much. Thank you both for providing those statements and a brief introduction to the work that you guys both do. It's great. It's great to have both different types of perspectives coming into this conversation today. So I would now like to pivot into a moderated discussion with you both and move through a series of questions that will really explore the implications of RSV in older and at-risk adults, as well as discussing the strategies to help support awareness and vaccination uptake within the Canadian population. So as we move through these questions, if any participants have related questions or comments, we encourage you to pose them in the chat box, and we'll try our best to have them addressed with our panelists. Now, I'll open the floor to the both of you with no specific order, and we'll welcome some conversation. Welcome some conversation between the both of you on some of the following questions. So I'll just start us off with the first question, which is from your organization's perspective, what are the most effective strategies for increasing RSV awareness and encouraging vaccination across the Canadian population? And as like a secondary part of that, how do you think NGOs and CSOs can fit into that solution?
I can start off here. I think one of the most effective strategies we have seen is funding the RSV vaccine, because research has shown constantly that when the vaccines are funded, there's always an increase in uptake. So a good example is that with shingles vaccine, 5 of the 6 Canadian jurisdictions that fund the shingles vaccine have the highest vaccine coverage across Canada. And what can NGOs and CSOs could do at this juncture is actually advocating for this change in policy regarding the funding, because last year many provincial and territorial health authorities were waiting for guidance from NACI before they make a decision on publicly funded programs. Now it's available, so it's really a push is needed to make sure that more jurisdictions actually fund the RSV vaccines moving forward.
And then maybe I'll add on to that. I think typically or traditionally our public health campaigns have been broad in nature, but focusing on some of those vulnerable groups and doing some targeted messaging, focusing on the immunocompromised and again the population that's most vulnerable to RSV, so the older adults, particularly with comorbidities, with compromised immune systems. The messaging in those public awareness campaigns needs to be tailored to address, again, the specific populations. Because again, it aligns with sort of the seasonal timing and awareness and leveraging the timing of the flu season to tie in the influenza vaccination with your RSV vaccination. That can often increase the uptake as well, because you're there already being assessed for your influenza vaccination. It's easy enough to take the additional vaccine for RSV at that time as well. And then in terms of that outreach, again, we're straddling a time where we need to use multiple media to ensure that our awareness campaigns actually reach Canadians. So again, not just through social media, but also traditional media, TV, radio, and even in healthcare settings, having those educational materials accessible, because it's important for not only healthcare professionals to have the education yes, we own the responsibility for doing some screening and assessments and nudging patients, but there's also value in the patients having, taking the initiative and having the autonomy to ask, hey, is this a vaccine that I should be thinking about, and getting an opinion. So again, I think targeting it from both the healthcare professionals and the patient lens is important.
Absolutely. Kind of integrating all different avenues and channels to kind of really make sure that it's, available, present, and kind of cemented into like the minds of patients. We have a question here from Richard Gould that I kind of wanted to address just because I think it's important to note. He has asked, he might have missed it, but he was just asking if any of you can speak to the effectiveness to the vaccine, because he believes that that information is quite important information to provide to the public as well as to providers. If you guys want to just briefly touch on that question.
Definitely. So we actually see that across not only the current two vaccines, but another vaccine that's currently being reviewed for approval, all three have shown effectiveness across that first year of vaccination. And some have even also shown that with that one dose of vaccination, the effectiveness has actually continued for across 2 years. So there is still more research, but the research has been very positive with what has become available in the last 1 to 2 years.
Yeah, I think the RSV vaccines for people over 60, again, there's three companies that are marketing the RSV vaccine, and I think in two of them they've shown to reduce the risk of lower respiratory tract disease. So again, those infection rates are dropping by about 80%, which is really high in comparison to some of the effectiveness that we see in vaccines. So that the ones that we have available to us are quite effective. And, as Arushan mentioned, we are seeing the sustained effect. Not quite sure yet, because again, the vaccines are new. We're not quite sure yet what the, cadence will be of how frequently you need to get the vaccine. Right now, we've got some data going to about 2 years that is showing sustained efficacy. So this may be part of your annual vaccine, respiratory season vaccine. But as the vaccine, as the formulations improve, they can often, provide sort of that sustained impact as well. And then you can have the vaccines a little bit less frequently, but that'll come with some time.
Absolutely. Thank you both for addressing that question. Thank you for asking that, Richard. So given, and this kind of moves into this question here, given the increasing focus on healthcare burden in recent literature, what do you consider to be the implications of respiratory diseases for social systems across Canada?
With respiratory diseases, research has actually taken place surrounding these social implications, especially looking at the impact of quality of life. For example, a study on older adults who were diagnosed with RSV, we find that actually participants reported impact on productivity, social activities, relationships, impacts various aspects of life. And this is not just with RSV, this is seen with other respiratory diseases as well, impacting that common activities individuals go through. It's evidently seen that they do actually have an impact.
Yeah, I'll add on to that and just say that respiratory diseases are the leading cause of hospitalizations, particularly during seasonal peaks, during flu season, RSV season. The implications, obviously, for the healthcare system are the hospital capacity. So we overwhelm hospitals during the winter season, leading to overcrowding in emergency rooms, intensive care units. And it's especially true during outbreaks and surges of RSV and flu cases. That obviously in turn increases the health workforce strain. It puts a lot of pressure on resources that are already stretched thin, leading to burnout and staffing shortages, and reducing the healthcare system's ability to deliver timely and quality care. And then the offside of that too is in our long-term care facilities and nursing homes. The respiratory diseases pose a dual challenge of managing the outbreaks amongst the residents, and then also dealing with the staffing shortages, because when there's an outbreak, you typically not only infect the residents, but also the staff that are caring for the residents. So again, we do sort of cycle the drain when we run into these outbreak situations. And I agree, the economic impact and social impact of productivity and increased absenteeism because of acute infections. It's a big challenge.
Yeah, quite a lot to consider from both of your answers. And that's why if prevention can be done and awareness can be brought about, we can kind of work our way towards kind of reducing at least the burden that is being placed. I have a next question, which I kind of want to combine with one of the questions asked by one of our participants, Shmuel. So my question is, what are the unique challenges faced by vulnerable populations, such as the older adult population, regarding RSV awareness and access to vaccination? And then I just kind of wanted to combine that with the Shmuel's question, where he kind of asks how authorities of Canada might try to ensure increasing awareness of RSV amongst older adults and those coming from lower middle income socioeconomic groups. So as like a kind of a subset of another vulnerable population, if you guys would like to take a stab at that.
So just to that first point there, we constantly see that among older adults, the main reason for not receiving many of the vaccines that are recommended to them is actually believing that it's not necessary. And this is seen across shingles, pneumococcal influenza among older adults, and that has to be targeted when we look at doing any outreach and awareness initiatives.
Yeah, so I agree. I think the limited awareness and education, the lack of public knowledge, and that it's typically combined with the underestimated risks. And so again, older adults may not be aware that RSV can lead to serious complications of pneumonia and bronchitis and hospitalizations. I think in terms of healthcare access barriers, again, we've got geographic disparities in rural and remote areas. Older adults often face more limited access to healthcare facilities where they can receive the RSV vaccinations. There's transportation challenges, longer distances to healthcare providers, and sometimes even fewer health services in those regions. And then I also think about our Indigenous and remote communities who often reside, again, in sort of very similarly a disparity where there's a geographic differential in access to healthcare services, and even the services that are there are often under-resourced and understaffed, and that obviously is a healthcare infrastructure challenge. And then, sorry, your secondary question around the role of governments to support. Again, I think that there's a few policy related considerations that can be addressed. So again, we talked a little bit about coverage. I think the recommendations from NACI are extremely critical in having sort of a unified approach for Canadians. But then the secondary step has to happen by the provincial governments to ensure that those particular agents are available, accessible by the public health facilities, but also the frontline healthcare professionals who will be actually administering them.
And that kind of also answers another question from Anna Maria, who asks who provides vaccination for RSV, for example. In the case of Ontario, it's covered by OHIP. So each province and territory will have their own immunization program and ones that are specific to specific diseases. And as you mentioned, Dr. Dami, it could be healthcare professionals, pharmacists. It'll depend province to territory who is actually administering the vaccines, but they all work in kind of concert together. Absolutely. So I'll move on to the next question, which is how can education and training for healthcare workers, public health professionals, and those working with vulnerable populations be improved to better serve and manage RSV infections amongst older adults in Canada?
I can start off here. I think as noted by Salsabila as well, and in my presentation earlier, it says that there is need in improving the provider's knowledge on RSV itself. We find that especially there's gaps regarding the epidemiology or the burden of RSV infection. So making sure that is focused on. And when we and other things to consider is trying in this training and education to also look into discussing that safety and effectiveness concerns regarding vaccines that we see commonly come up regarding the public and their vaccine behavior.
Yeah, I agree. Yeah, integrating the RSV knowledge and the clinical pathways for treating RSV. There's not a lot of drugs we have to be able to treat RSV. There isn't actually any, antivirals that are going to treat that. So our best, our best offense is good defense, and so we do want to take a preventative strategy for RSV and integrating it into sort of the standard clinical training for healthcare professionals, and getting that education early as they're doing their training. And then also enhancing the vaccine education. I think some healthcare professionals do a better job of training their particular profession on vaccine related hesitancy and why people are hesitant and how to support and provide information to patients to help them make important informed decision. I think there's opportunities also to target some training for long-term care staff, again, both from an infection control protocol perspective, but also just again knowledge and awareness about RSV itself.
I agree with both of you on all of that. So I'll move to the next question here. So currently, I believe Ontario is the only province or territory that has announced an RSV program for specifically for older adults at the moment. And there is conversation about the lack of equity, as you mentioned earlier, as RSV may be included in some provincial programs, but not in others. For example, British Columbia, they're not expecting any additions to their programs right now due to upcoming provincial elections as well. So, considering all of this information, there really is an urgent need for awareness efforts and advocacy for provinces and territories to include RSV in their publicly funded programs. Apologies, I think there might be an alarm going off right now. But looking forward, what key changes are required at the national or provincial level to better address a more equitable approach to RSV prevention and vaccination in Canada?
So I just want to note actually this information was just became available last week. So
Okay.
yeah, so Ontario, yes, was the first jurisdiction to cover RSV vaccine last year. They continue it this year, but also we found that Nova Scotia actually funds the RSV vaccine for residents of long-term care homes. And also New Brunswick also does the same thing, funding the RSV vaccine for into 60 years and older living in long-term care homes. And for both of them, even those who are waiting for placement actually can also get the vaccine itself. So it was just a recent change, but it's a good improvement seeing that increase in coverage. So just to answer the next question about what changes to be done. So I think as we noted, providing more publicly funded vaccination programs, providing clinician education support for not only primary care providers, but also pharmacists and other healthcare providers, and harmonizing vaccine administration so it's consistent across the country. And lastly, that's very an important point is ensuring that there's accurate reporting and monitoring of RSV vaccination rates. Just because this is very new, so it's important that we can see how well it's being uptaken across various populations across the country.
Absolutely. Thank you for the update on Nova Scotia and New Brunswick. It's fantastic to hear that they're moving forward with those policies. Rita?
To be honest, I didn't have anything else to add. I think
Yeah.
Christian covered it all. We'd love to see a national vaccination program. We'd love to see the public health awareness program and the alignment and strengthening sort of the and harmonizing the healthcare infrastructure around coverage and consistency in the policy. And the RSV surveillance I think is really key too.
Absolutely. Absolutely. And so under the recent update with the Government of Ontario's provincial health program, individuals aged 60 and older are eligible for a publicly funded RSV vaccine if they belong to one of the main groups that they've considered. And individuals who do not qualify based on that criteria will have to purchase the vaccine with a prescription from their primary care provider. So with these kinds of new recommendations in place, and even, for example, you mentioned Nova Scotia, New Brunswick, it's kind of specific to those belonging in long-term care or, specific criteria. How do you think that will impact the overall awareness and immunization rates for RSV vaccines within those provinces?
I think there will be a lot of media attention with that, which we noticed with Ontario as well, that will increase awareness, but more work needs to be done because we're focusing on very particular populations. So there's that education, that aspect needs to be taken into place, and that needs to be considered moving forward.
Yeah, I often find that the coverage piece, the publicly funded vaccines generally do have to have an increased uptake. So I anticipate that in Nova Scotia and New Brunswick, we will see an uptake in the RSV vaccine this year, which is great. I think long-term care residents in particular are at particular higher risk of more of the severe outcomes. And so ensuring that widespread vaccination and structuring a policy to help support that is a great start.
Yeah, absolutely. And I just have a follow-up question to that. What effects might these changes have on public health outcomes, access to healthcare facilities for these vulnerable populations?
I think this will increase access, but all a bit depends, I feel, on the urgency because we see, such as with the COVID-19 vaccination rollout, a lot was done to increase accessibility and awareness. So it really comes down to how the governments really push the vaccine rollout, and to ensure more people take on the newly approved RSV vaccines.
And if you don't have anything to add, Dr. Adami, perfect. So I have another question here from the audience here, from David Richardson. So he says, sometimes I think health prevention campaigns are focused more at the macro level, but don't really trickle down to the micro community level. How can the message of adult vaccination be promoted with municipalities and at the community level?
So I think something to add on to that point, I think it's sometimes, as noted, which I even Steve and I review at the provincial level, the awareness that's being done. It's very macro level. What can be done to focus on specific groups is focusing on such as ethno-racial groups, immigrant populations, because we notice that vaccine varies greatly among these different groups, sometimes even being lower than the general population. So making sure that there is awareness targeted to these specific groups that might be more predominant at certain municipal levels would be something that should be looked at. And we see that when we target, like such as the knowledge and language barriers regarding for these populations, uptake of vaccine increases.
Yeah, no, I was going to echo the same thing. It's really about becoming a bit more nuanced in the way that the materials are communicated, ensuring that the communication of that, the public awareness campaigns, crosses different levels of education. It crosses different languages. The materials are available and echoed in places where maybe traditionally, traditionally they haven't been. So, outside of just the general practitioner or primary care facility, the information is, we try to find ways to engage with the community at or potentially community events, or there's mobile clinics that are available. That's how you actually get right into the community and accessing some of those more vulnerable populations.
Yeah, the impact of, being face to face with someone actually giving you the information right there. It is it is quite impactful and does make a difference on individuals' decisions to actually go forward with vaccination. So it is definitely absolutely something to consider. We need to have both macro and micro actions and policies and work being done. So thank you both for kind of going through all of those questions for our discussion. fantastic answers, new information that we've also learned today. So as we're nearing the end of this interactive dialogue, I wanted to take some time and invite you both to propose some recommendations based on some of the discussions, based on the discussion that was presented during this dialogue. And so, as Salsabila mentioned earlier, these recommendations will support the development of a consensus statement to key stakeholders on increasing RSV awareness and vaccination. So, if either of you wanted to kind of go ahead and start with, some of the main kind of recommendations you would put forward.
So I can just maybe start with two, especially focus on what we talked about today. One is just ensuring that there's more focus on ensuring there's publicly funded RSV vaccination programs across the country. And secondly, ensuring that there's harmonization regarding vaccine administration practices across provinces and territories.
Yeah, I'll add on to that. So again, I think that targeting RSV prevention strategies is really going to need a multifaceted multifaceted approach. So I 100% agree that governments need to focus on that policy framework that will harmonize the access and the funding of the vaccine. Public health can focus on the large scale macro awareness campaigns, CSO engaging in community level advocacy and education. From the healthcare provider perspective, offering direct prevention and care services, focusing on early detection and screening for the high risk population and vaccination. And then from the community perspective, again, building that local resilience will happen through some education, but also some grassroots efforts, and again, support for those most vulnerable populations.
Yes, and I agree with Dr. Darmi's points. And I think, as noted, when we focus at like the NGO CSO levels, it's like pushing that policy advocacy regarding funding administration, ensuring there's resources for healthcare providers and the public, noting on some of the groups that we have noted today that may need additional awareness and outreach.
Absolutely. Well, thank you both so much. The fight against RSV is ongoing, and we really do have to unite from all different groups and individuals to really boost awareness, promote vaccination, drive these policy changes to help safeguard the lives of Canadians and really ease the burden of this vaccine preventable disease. So it's really crucial that we elevate awareness of the disease, particularly its severe impact on older adults and at-risk populations, those with chronic conditions. And by advocating for the importance and accessibility of RSV vaccination, we really aim to kind of reduce its significant health and economic burdens, as both of you have mentioned throughout the discussion. And so we know we need to work together, ensure these efforts lead to real meaningful improvements in public health, and really reduce that RSV-related suffering. So on behalf of the IFA, I would like to extend my sincere thanks to both of our panelists today, Dr. Nami and Mr. Arul Nambi, for engaging with this work and for providing us with these fantastic insights. I would also like to thank my colleague Salsabila for all of her work today on this dialogue. And finally, many thanks to all of you for attending today's session. Hopefully, we've all gathered some great information to pass on to your own organizations or your own community efforts or at the the government level. So hopefully this has been very knowledgeable for all of you. So thank you once again, and please enjoy the rest of your day. Thank you so much. Take care.